All right, hello everyone. My name's Andy Craig and I work for the Canadian Partnership for Women and Children's Health, and it has been my pleasure over the last couple of months to lead on the youth component of the conference and to engage with a group of fabulous young people who you've heard from throughout the conference, who've really challenged us to say yes to them and their ideas as often as we can, to make their ideas happen and come to reality, and to live up to their expectations and hopes for this conference. And I hope that has come to pass, and we wanted to give them a chance at the end, the penultimate session, to say how we did, to tell us what they heard as a group of young people who are actively engaged in this moment, from the earliest planning of the themes, the selection of speakers, to recruiting other youth, to participating on panels themselves, to tell us how we did, what they heard, and I'm excited to hear what they have to say. So, and they have this really fun mic, so come on up, guys.
Sorry, we're just trying to fit everyone.
No offense to you, don't waste your time. Okay. Here's why.
Awesome. Well, a big thank you to CanWaCH and our partners for creating the Conference Youth Council and for supporting us for the past few months. A big thank you to Andy, Katie, Leah, Ali, and Charmaine for also supporting us the entire way. We would not be here without you guys. We are 10 bright young individuals, and we were brought here together to create this council and to ensure youth voice, participation, and engagement were a vital part of this conference. Although we come from all parts of the world, we cannot represent every youth voice on this planet. But we are, however, representing the outcome of what happens when you invest in youth. So we would just like to share a few key words that we have picked out of the past 2 days that inspired us and hopefully inspired you as well. Participation. So when I think of participation, I immediately go to youth. I'm sure some of you might as well, but I also think of participation from government, participation from world leaders, and participation from professionals. I have said before, we should encourage not only youth to reach out to leaders, adults, anyone that they look up to, but it's also important for professionals, leaders, to create that platform that they are able to bridge the gap and communicate and participate. And in the powerful words of the Deputy Secretary General of the UN, Ms. Amina Mohammed, we need not to see borders, but to see the world as one. So not only participation from each individual nation, but participation on a global front.
Okay, and the next word is holistic. So I think I did hear this word a couple of times during the conference, and what really stood out for me when I heard this was recognizing that adolescents shouldn't be seen as a homogeneous group. Ideas as well as solutions that are targeted at adolescents shouldn't be seen in silos. And all the programming as well as information that is disseminated to young people should be formatted in a holistic type of way, as well as ensuring just that the comprehensive sexuality education that was spoken about a lot includes information that is holistic in nature, age appropriate, and ensures that adolescents are always included and incorporated in the global agenda when we talk of adolescents. So I think also just to match this quote and speaking of holistic, is a quote that was said by one of the participants, and it's an African proverb, and it goes by, if you want to go far, go alone. But if you want to go fast, go alone. But if you want to go far, go together.
Thank you. I don't know how to top that, but the next thought would be unique needs. I believe it has been established in this conference that adolescents have very unique needs. It's a period of transition, and if you make a wrong move in this transition, you kind of make a huge mistake, or you kind of have this, you're gonna make it wrong for the life of that adolescent. And especially for children and young people and adolescents in emergency situations where they're put into adult roles and continue their lives as adults without enjoying the life of being an adolescent. So meeting the unique needs of adolescents has been established to be an integral part of our development work and the work of the young people here on stage. Thank you.
And the next word we have is evidence. So throughout this conference, we've really seen the importance of supporting data for evidence-based policies, evidence-based research to be conducted. We've had different speakers talk about quantitative data and the way that they collect it through various surveys, but also on the ground and using communities to do that. We've also seen qualitative data being conducted with interviews and focus groups, and also how the critical and difficult nature of conducting research in areas of war and areas that are experiencing crises all over the world. So really validating research, but also more importantly, validating the turnaround of research to implementation and really applying research so that it's not just up in books and up, on the Lancet, but also being implemented into action.
So the next word is amplify, and to amplify is to amplify your voice. But during this week's conference, we weren't only amplifying our own voice, we were amplifying the adolescents who have really huge gaps in terms of the lack of resources in mental health and other health aspects. And to recap on what I said during my panel yesterday, I spoke on behalf of First Nations youth and First Nations youth suicides and mental health. And I had mentioned that there is a prophecy within my culture and within my people of the Ojibwe descent. We are currently in the 7th generation, and we are amplifying the voices of this generation to make way for the 8th generation in 10 years come. And each set of generation is in the amount of 20 years. And since Canada is celebrating its 150 years, we have been here for 7 generations, and in 10 years come, we will be within the 8th generation.
So my word is collaboration, and I think this whole conference is the result of collaboration. CanWaCH and all of our partners working together, and throughout the conference I heard collaboration a lot. So there was a lot of discussion around collaborating across sectors and multi-sectoral approaches to address common issues that we can work together with. There was also a lot of discussion about collaborating with youth themselves, and one thing I heard a lot was nothing for us without us. And I thought that was really powerful. And finally, there was a lot of discussion about collaborating between organizations that are working in the Global South and organizations in the North, and how we can address these issues together.
Yes, investments. Well, I don't know, but maybe I should start with a Viva, right? Viva CanWaCH, Viva! Viva! Viva Adolescent Health, Viva! Viva! Viva Investments, Viva! Viva! Exactly. So, so investment, yeah. I think we've talked about a lot to do with invest in young people, invest in adolescents. I think investment is like one of the words that has been said here for like over and over again. But what I personally think and what really I figured out from all the discussions was, you know, like investing in those policies and programs that are adolescent and youth-centered, like that directly address and meet the needs, the unique needs, like Anthony said, of adolescents and young people. And, you know, like being able to have the young people on board to be able to highlight out what their needs are, and so that the policies and programs are able to, you know, like capture them. And also, I think it's high time that with all these discussions that we figure out investments that actually allocate budgets to adolescent health, you know, especially at national level, you know, that it's like all these plans, you know, policies, programs at national level, even at regional level, have money, like money that is actually in place to support their implementation. And also investments in terms of integration of services, adolescent and youth services within the mainstream existing services. And also investments in quality, non-judgmental, comprehensive services that meet the needs of adolescents and young people. So I feel like that's the kind and the level of investment that we need to push forward the adolescent health agenda. Thank you.
So pretty much the word action has echoed all through this conference. Pretty much all the panels touched on the word action. And to me, when we talk about action, to me it's both individual and collective action, short-term and long-term action. And I think we're about close to 400 people in here. If we could each leave this place with one action. Any action is not small. An action that can empower an adolescent, an action that can change the life of an adolescent, and we should hold our leaders accountable. We should make sure that young people are the main focus of our everyday life. And because I think we are one world, we are one community, and we are one family. And just as Mohammed Gandhi said, go be the change that you want to see in the world. Thank you.
Actually, no, that wasn't the word. Okay, my word is not on the screen. It was human-centered. So going back to the first things that we opened this conference with, above all, adolescents are human beings, and everything that we have spoken here in technical terms and pillars and all these different technicalities are essentially about human beings that are the very essential turn of their lives. And we're happy that there was a call for human-centered design in all that we do, to put adolescents and their needs in the center about everything else. And since I have the last turn with this lovely thing, I would just like to say, on behalf of every one of us, that it was an absolute pleasure to be working on this conference. We learned a lot, we met inspiring people, and we just are filled with energy when we're going back to our own communities to carry on the work. So thank you everyone for being here, and thank you for sharing this amazing experience with us. Viva! Viva!